Jason, how do we define insomnia and how does that differ from just struggling to sleep?
Yeah, so when we talk about insomnia as a disorder, we're talking about a dissatisfaction with sleep, and that's usually either problems getting off to sleep, staying asleep, or waking up too early in the morning. And that should occur despite having enough opportunity for that sleep. On top of that, we talk about it should be creating some form of daytime distress or impairment, things like concentration, mood, ability to caregive. Something has to be impacted by it. And then we talk about generally for 3 nights a week, for at least 3 months to be a disorder.
Right.
Now, of course, that's not to say if somebody visits in clinic, but they're 2 months, you're going to throw them out. Of course not. But that's generally for our diagnostics.
And do we know what causes it or what the various causes are?
There's been actually quite a lot of research about the causes of insomnia. There are some things that make people more vulnerable to insomnia. So having insomnia in the past does set you up for another occurrence. Being female,
Right.
being older. You've also got some personality traits that we talk about, high neuroticism, high anxiety, more stress-prone personalities. But there usually has to be some sort of trigger event.
Right.
Now, we used to talk about that in terms of a life event, a bereavement, divorce, loss of money or a job. We're now starting to understand that lots of little stresses can build up and push us over that edge into having insomnia.
Okay, so it's, I guess, closely linked to stress and distress, which we're seeing just more of generally in society at the moment.
Absolutely.
Can we cure it?
It's a great question. The way that we try to manage insomnia and the first line treatment that's recognised is called cognitive behavioural therapy for insomnia. And what we're doing there is we're looking at those thoughts and feelings that keep people awake, having unrealistic expectations of your sleep, for example. But we also look at some of the habits and patterns that people have got into that may seem quite logical and rational to do, but actually they destroy the sleep itself.
Right.
So by managing those, we're going to manage not only getting into bed and feeling comfortable, relaxed, both physically and psychologically.
Okay. And how available is CBTI? So I recognise that it is the gold standard treatment for insomnia. How can people access it?
It's a bit of a challenge because there aren't that many people who are trained in it, so it's actually quite regional at the moment.
Right.
There are options which are moving towards providing it online.
Okay.
And certainly it's worth discussing with your GP to see if it's available online in your region.
Right. Okay.
Outside of that, there are some good books out there on CBTI,
Okay.
but I really would recommend to be therapist-led.
Okay.
In terms of cure, well, we don't know. What we do know is about 70 to 80% of people who do go through CBTI and they go right the way and don't drop out, they tend to get better. They go into remission. And we know that that lasts for the majority for them about 10 years.
Okay. All right, well, that's pretty good then. So there's some hope.
There is definitely hope on the horizon.
Okay, thank you.